So you're talking about this manual annotation process now. So we get clinicians or humans or whoever to go through these notes and basically tell the machine what to anonymize and mark it, whether it's correct or incorrect on the ones that it has recognized. Yeah. So that part is actually essential, and that's probably the secret ingredient to how to build a really good anonymization model, right? That's the difference between these posters. Because I looked at one of the other posters. There's many ways to annotate, and some people maybe just do one cycle, some people have one annotator, some people have a team of annotators. The problem with bigger teams of annotators is that there's more variation, right? So they need to be really aligned, and we talk about this concept of inter-annotator agreements. So, how much is person A versus person B annotating differently? If they're all very poor agreements, then the model will really struggle to learn, right?
So this inter-annotator agreement, how you measure it, you basically give the same 10 documents to multiple people, and you check, are the annotations different? So how in the percentage of the annotations that are the same between all of these people and the percentage that's different. So that's how you get this inter-annotator agreement. And so that's one of the main ways that people do it. You want to have that inter-annotator agreement close to 1, which means
one is a perfect overlap.
Exactly, which means like everyone is doing exactly the same, everyone understands the task in exactly the same way. And I was thinking it's simple. I mean, I completely agree that it is complicated for annotating diseases or symptoms or what, but I did not think it's hard for annotating. Like, you are annotating a name. It's just a name. You cannot...
You'd think it's quite binary. Like, that's a name, that's not a name.
Exactly. But the more you go into that, the more you see like different things. So sometimes someone, like a person or a doctor or whatever, will also have a middle name. So we usually, when we are annotating, we have like first name, last name. We didn't have middle name. So occasionally someone will annotate the middle name as the last name, someone will annotate it as the first name. And sometimes you will also have the first portion as initial, so J.Smith, like for John Smith.
Or they flip it, Smith J.
Smith J or something. So someone would then be confused, okay, like, is this J now an initial? Or because it is now together with a name, is it also, is it a name? So like,
and Smith could be a first name theoretically. Their name could be Smith Johnson or something, like Smith J. So it gets so complicated that it is unbelievable. It is so hard to get the inter-annotator agreement to be like really at 1. And even if the annotator agreement is good, it doesn't mean they're annotating correctly as well. So that's the difficulty. And you really need to go deep into the health records to know whether Smith J, whether Smith was the last name or the first name.
I mean, that's true. Even though it is still one of the most important things is consistency, at least for training of the model. Even if, sure, okay, it can happen that the annotators are mistakenly annotating all together in the same way, first name as the last name, but you don't really care too much about that.
It doesn't matter, as long as they're all redacted, it doesn't matter, right?
Exactly, So you want to just be able to remove that, and the fact that you replaced a first name with a last name, who cares really? The only thing you don't want consistent mistakes is missing stuff. So of course there you don't want to be consistent in missing a name constantly and then not redacting that once you train the model. But so this part is in fact very difficult and very time consuming. So if you want to do these properly, what you basically need is multiple annotators doing the same thing.
Exactly.
So what you would have is you have your, so let's just mention this, like to train one of these deep learning models, it is usually recommended to go above 1,000 mentions of something. So 1,000 names, 1,000 addresses, 1,000 whatever. So imagine this, and then instead of having one person annotate these, now you need 3 people annotating the same thing. So annotating the exact same documents for the exact same entities. So you're basically tripling the amount of work you need to do because you now have 3 annotators, so that you can be sure that everything is removed.
Yeah.
So you can be sure that they found everything.
But there's more than 1,000 names, and way more.
No. Yeah, no, of course. Yeah. But this is, you hope that the model would generalize. You show it those 1,000 documents with 1,000 names, and then you hope that the model learn like, oh, this is a name, and then it'll generalize to.
But would it be helpful to like pre-enrich it with a dictionary of, because obviously there are many dictionaries of names that exist online already.
Yeah.
Can you like feed it that first? And
people do usually try that. It doesn't help at all.
Really? That's surprising.
Yeah, it turns out most of these things we do manually don't help because it is extremely simple for the model to learn that.
Yeah.
So it turns out like the model very easily understands what's a name. Where the model gets confused is when something can be a name and also something else. So that's where things maybe get problematic, and that the model has to learn, but it doesn't learn that from a dictionary. It learns that from seeing many examples of the one thing and many examples of the other thing. So this is like
understanding the context in which they're mentioned.
Yeah, this is the Parkinson's example.
Yeah.
The model sees 100 So if, for example, your model never saw a Parkinson's mention in a sense of a disease, then it would maybe have some trouble with that.
Yeah.
But if it saw that 10 times, then...
And you've told it this is incorrect.
Yes.
This is not a name.
Exactly.
Then it will understand.
Yeah, exactly. So, but what we have done in the recent paper was basically invent a novel way to do that annotation so that we don't have to triple the amount of work, but we can still have just one annotator doing the annotations and have a bit of extra work after that, but maybe only like 50% more and not 300% more.
Yeah.